Hey everyone, and a huge welcome to all of you first-year medical students joining us today. You are in exactly the right place. Welcome to this Med Simplified Hub Explainer, where we're going to break down the absolute foundational rules of the human body. You know, when you hear those drum rolls in your head, it's go time. Let's start with the golden definition. Anatomy is, quite simply, structure. Before we even think about how things work, because honestly that's physiology's problem, we have to answer three absolutely vital questions. What is it, where is it, and what does it look like? And really, that's the whole heart of what we're covering today.
So why does anatomy actually matter to you, sitting right there, right now? Well, because anatomy isn't just some abstract theory. It is literally life-saving knowledge. Imagine a scenario where a patient comes in and you don't know exactly where a specific organ is located. How are you ever going to figure out what's wrong with them? Spoiler alert, you can't. We completely rely on anatomy for diagnoses. In the OR, one wrong cut into the wrong structure and, man, imagine the kind of absolute disaster that causes. You're here to learn the map so you never get lost when the stakes are at their absolute highest.
Okay, here's our quick roadmap for today. We'll hit the basics, the anatomical position, planes, cavities, and then wrap it all up with a practice quiz.
All right, jumping right into Section 1, Basics.
There are basically two main levels of anatomy that you need to get comfortable with. The first is gross anatomy. Now, this doesn't mean gross as in yuck, it just means the big stuff. In gross anatomy, we're dealing with things you can easily appreciate with your own two eyes. Think about holding and looking at a whole human brain. If you can see it without any extra help, that is gross anatomy. On the flip side, we have microscopic anatomy. This is, you guessed it, the tiny stuff. If you have to employ a microscope to see and understand what's going on, like looking at specific cells and tissues, you've officially entered the microscopic world. So just keep it simple. Big stuff equals gross, tiny stuff equals microscopic.
Moving right along to Section 2, Position.
Listen up, because this is arguably the most crucial, non-negotiable rule in all of medicine, the standard anatomical position. This is where a lot of students trip up early on, so pay close attention. It's a standard reference position, and it's standard because you literally do not have a choice. You have to memorize this exact posture. Whenever you discuss anatomy anywhere in the world, medical professionals picture this exact stance. The person has to be standing upright, absolutely no bending. They have to be facing forward. The palms must be facing forward too, held beside the body but just slightly away from it. And finally, the feet should be flat on the floor, legs straight, with the feet slightly apart. Burn this visual into your brain. It is your new baseline.
Let me save you from a super common yet very dangerous mistake. If you ignore this standard anatomical position, you are basically sending an open invitation to medical miscommunication. Picture a hectic operating room, and the surgeon says, "Make the incision on the right." Well, if you aren't using the standard position, you're left standing there guessing, wait, does the doctor mean his right or my right? But by always assuming the patient is in the standard anatomical position, everyone in that room is on the exact same page, every single time. No guesswork involved.
Let's dive into Section 3, Planes. So a plane is really just a theoretical, imaginary line drawn right through the body. The very first one you need to know is the sagittal plane. This plane divides the body into right and left sides. But I want you to appreciate a very specific variation here, the mid-sagittal plane. Mid literally means middle. So a mid-sagittal plane is an imaginary line that cuts the body down the exact center, giving you perfectly equal right and left halves.
Next up, we've got the coronal plane. This line divides the body into anterior and posterior sections. Now, as first-year med students, you're learning a whole new language, and anterior and posterior are really just fancy clinical words for the front and the back. So the coronal plane separates your front half from your back half.
I want you to think of the human body like a loaf of bread for a second. I know, it's a slightly weird analogy, but trust me, it brilliantly illustrates the difference. If you take a knife and slice that loaf of bread right down the middle, separating the left half from the right half, you're making a sagittal cut. But if you turn the knife and slice the front crust completely off, separating the front of the loaf from the back, well, now you're making a coronal cut. Visualizing these 3D spatial concepts is absolutely key to mastering your anatomy.
Our third major plane is the transverse plane. This one divides the body horizontally into top and bottom sections. Again, pulling out our clinical vocabulary, superior means top and inferior means bottom. If you want to sound sharp on the wards, you'll say the transverse plane divides the body into superior and inferior portions. Going right back to our bread analogy, this is how you'd normally cut a loaf of bread to make a sandwich. Just many, many horizontal transverse slices.
So, what does this all mean in real-world medicine? Let's look at a quick clinical case study. Imagine a surgeon is handed a transverse CT scan printout.
If they didn't have a deep understanding of anatomical planes, those images would just look like a bunch of random blurry gray shadows. But because the surgeon knows they're looking at a transverse slice, a horizontal cut looking from the superior to the inferior, they can correctly identify the precise position of a tumor relative to a major blood vessel. Applying this anatomical knowledge literally prevents the surgeon from making a fatal cut. These planes are the foundation of all CT scans and MRIs. And transverse, that's the one you're going to use the most.
We just have one final plane to cover here, and that's the oblique plane. Think of this one as the rebel of the group. It is strictly angled. It's neither purely vertical nor purely horizontal. If an imaginary line cuts the body at any sort of diagonal angle, you are looking at an oblique plane.
All right, on to Section 4, cavities.
It helps to think of body cavities exactly like rooms in a house. Houses have many different rooms to serve different purposes, right? Well, so does our body. We basically have two major wings to this house. First, the dorsal cavity, which you can think of as the back rooms. Second, the ventral cavity, which represents the much larger front rooms. These main cavities are basically safe spaces that house all of our vital, delicate organs and keep them protected.
Let's actually look inside these rooms. In the back, the dorsal cavity has two subdivisions, the cranial cavity, housing your brain, and the spinal or vertebral cavity, which houses the spine. Now look to the front, the ventral cavity. This one has three main rooms. Up top in the chest region is the thoracic cavity, home to the heart and lungs. Once you cross the diaphragm muscle, which is kind of like a floor, you enter the abdominal cavity, housing organs like the stomach, spleen, and liver. Finally, our last room is the pelvic cavity, located at the very bottom where we find the reproductive and urinary systems.
Time for Section 5, the practice quiz. Let's see what you've got.
It's time to see what you've retained today. Active recall is for sure the best way to lock in this life-saving knowledge. Question 1. Which anatomical plane divides the body into top or superior and bottom or inferior sections? Think about slicing that loaf of bread for a sandwich. Have you got it? It's the transverse plane. Excellent job if you nailed that one.
Okay, let's try question 2. If you were dividing the body into right and left sides, which plane are you using? Remember that invisible line running right down the middle of the body? That would be the sagittal plane. And remember, if it gives you perfectly equal halves, you call it the mid-sagittal plane.
Last question, you guys. Which plane divides the body into anterior, meaning front, and posterior, meaning back sections? Think of slicing off that front crust. Yes, it is the coronal plane. Fantastic work. Mastering these imaginary lines means you're going to be able to read pretty much any scan handed to you on the floors.
As we wrap up this explainer, I really want you to burn this core takeaway into your brain. Position matters. Anatomy is structure. It answers what it is, where it is, and what it looks like. But frankly, none of that matters if we aren't all using the exact same map. Mastering the standard anatomical position, the planes, and the cavities is how you prevent fatal miscommunications and how you interpret those complex scans. In our next session, we're going to dive even deeper into the clinical language by tackling directional terminologies. But until then, I leave you with this thought. If anatomy is the blueprint of the house, how well do you really know the rooms you'll be spending the rest of your medical career trying to fix? Keep studying, keep reviewing, and I'll catch you in the next explainer.